If you've never heard of a condition called cardiogenic shock, you are not alone. It's a rare condition usually caused by a severe heart attack. New research shows a higher risk of death to patients. Our focus this morning is what can be done about it. Interventional cardiologist Dr. Perwaiz Meraj and Jara Herron survived the condition. Both join us now. Good morning.
Good morning.
Doctor, cardiogenic shock, what is it exactly, and how is it different from a heart attack?
Sure. So I think we all can be familiar with what a heart attack is. We've either seen it on TV or hopefully, unfortunately, never seen it in our own family members or ourselves. But it's that chest pressure, clutching of your chest, that arm pain that you develop suddenly. And we've done very well over the years to really treat patients like this, and they do extremely well. But about 1 in 10 patients who have a heart attack can develop cardiogenic shock. And they will. And it's usually a most severe form of a heart attack, where the blood supply to the heart is compromised, and the heart is essentially the pump for all of your blood in the body. So when that heart is compromised and the blood flow is compromised, the whole body doesn't get enough blood, doesn't get enough oxygen, and it really starts to shut down. And it's a devastating experience for patients and their family members. And for us, it's a very time-sensitive situation where we need to treat patients with cardiogenic shock very quickly. Because the unfortunate reality of it is that more than half of patients that come to a hospital will not make it out of the hospital in cardiogenic shock. So it's a very, very severe disease and a very significant problem that we have.
Jara, I mentioned you survived this. What did you experience?
Well, even though I had no heart disease and was a totally healthy person, shortly after the birth of my 6th child, I suffered a massive heart attack, the result of which I had to be life-flighted to my local hospital in Tulsa, Oklahoma, where I arrived in a cath lab and 6 stents were placed into my heart to restore blood flow to and from. But meanwhile, my heart had rapidly deteriorated and I did go into cardiogenic shock. So what that meant for me, and I can paint that picture for you, is all of my organs were failing and stopped working, and I had to be on life support and assisted. I had numerous complications at the ICU, and I was immediately put on a heart transplant list. My heart was so damaged. I got turned down for a heart transplant simply because my survival odds for everything else that was happening to my body were very slim. So fortunately for me, I got the therapy of the Impella heart pump, which was placed in my heart and basically allowed my heart to rest and recover and survive all the complications that I had in the ICU, including an emergency intestinal surgery that I had to undergo. So there was a point where that was actually pumping my heart for me. So had I not had that technology and access to that device, most likely I would not have survived the cardiogenic shock.
How are you today?
Well, my recovery has been pretty amazing. I function normally. I actually even gave birth to my 7th child since this traumatic event. And if you saw me walking down the street, you would never really know that any of this actually occurred.
Doctor, what should you do if you or a family member is having a heart attack?
Sure. The most important thing is get medical attention immediately. Call EMS, get 911 there. Have them evaluate you, and really, if you're having a heart attack, and especially if you're having signs and symptoms of cardiogenic shock, it's very important to go to a specialized heart center or heart hospital where they have these pumps available to them to help take care of you, your family member, or your loved one. It really can make a difference between life and death, but not just life and death, but really quality of life. If you survive, you really want to survive with a great quality of life. And the quicker we get to patients in cardiogenic shock and the quicker we can use these heart pumps on these patients, the better their overall survival can be.
Is there a website where our viewers can learn more about the pump or this condition?
Definitely. I think the one website that everyone should go to get more information about cardiogenic shock is cardiogenicshock.com. It'll give you a rundown of all the disease processes, the signs and symptoms of the disease, as well as the available therapies. I think it's an invaluable resource to all the viewers and everyone out there because knowledge is power.
Thank you both for joining us. We really appreciate it and all the best.
Thank you for having us.
Thank you.